everyone, my name is Blessing. I'm out here in the streets of Calabar to seek the opinions of people about what they think of the healthcare delivery system in Cross River State. Join me as we go into the street.
Yes, I have visited the primary healthcare center around my location where I stay. The government needs to do more to update the facility, because when I visited that place, I was not really pleased with the way the government handled the staff welfare. Some of the primary healthcare workers were sitting outside. I think it's because they don't have enough space or the chairs are not good, so they had to manage with the few chairs they had outside. Whenever they are needed, they will now go in and attend to patients. So it's not very good enough.
When you go to the hospital, you meet different patients with different disease conditions, and you're able to put in one or two to alleviate pain and suffering from them. So I feel I am living my best life.
School environment is very conducive. We have the lab, we have the nursing procedure room where we get to practice procedures before we go to the hospital to practice this thing with live patients.
There is deficiency of manpower in our health sector, and this is really dragging us back in delivering care. Professionals are so stressed, they had to do beyond what they ought to in a day. We need more manpower in our health sector.
Well, the primary health care center there is okay and functional, but boiling down to the staff nurses there, they are not enough. So you hear people complaining of services not being rendered immediately, so they have to wait for a long time. And then the doctors there are not easily available for emergencies. So sometimes they have to put a doctor on call, and before he gets there, so nurses also have to try their best to do the little they can while waiting for the doctor. So I think health centers actually, especially the one at Main Avenue, really needs doctors available.
Once you have manpower, you need tools. I think the government also have to look into the area of providing things like gloves, cotton wool, ventilated spirits. If you look at it, it's so burdensome on patients.
How about the machines?
Oh, we don't even have to talk about machines when we don't have the basis. We don't even have to go there. Let's only focus on these little things that tools that we lay our hands on to carry out duties. I think if we can get that, it will help revive the health sector, and our care delivery will be better.
They're also lacking some equipment as well, though they have, but they really need more. They also need the scan. Then their laboratories also need to be equipped. For example, you'll be hearing them talking about the cold chain system. They need a cold chain system where the vaccines can be readily available for use.
So I think government need to do more. Right now that there is no commissioner for health, and I don't know when we are going to have it, maybe in the next regime. So we need to have a person from the government that is looking after those facilities to make sure they are functioning to the maximum.
Welcome back from the streets. Now we know what people think about the healthcare delivery in Cross River State. We hope that the government will wake up to their responsibilities in providing an efficient healthcare delivery system that meets the need of our citizens. I remain Blessing, and thank you for joining us.